Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to show you this. Actually, some people had asked about forehead. They were asking about what to do about scars for the forehead this week. So I wanted to show this result. This is a patient, really nice gentleman, and we've been working on him with a few different modalities. You could take a look and see, look at how smooth his forehead is. So this is really amazing because we improved scars that were really stuck, that were really, really deep. And we also solved some of just his deeper lines and wrinkles. If he's somebody who just keeps up with like things like Botox or Dysport or Xeomin, something else just to relax the muscles over there, we're going to be able to allow this actually just to, this whole area just to look a lot better. But if you look at this, you can see this is what we could do when with scars on the forehead. Actually, I'll pull the photo down a bit more so you can see it a little bit better. And it's something I do a lot with. Actually, I do a lot with forehead filler. And in this case, we did some forehead filler. We also did a little bit of TCA and laser. You can't in this area use like high heat or high energy lasers because what ends up happening is that you could actually cause the scars to get a little bit worse. You're going to find that these scars are really, really deep. It's going to be very, very difficult to go down to the base of those scars. It's almost impossible really because of just the fact that it goes close to the fatty layer there. So instead what we want to do is actually just use different modalities. We used subcision. We did, again, TCA cross worked out really, really well for this patient. And we did do laser, of course, but it just wasn't like this this very, very aggressive form of it. More for like localized areas, and then a lot with some volume replacement. This is we started his journey in October of last year, and here in April you can see where we are right now. So it's really, really nice actually just to see here this process. In fact, actually, I think that we've actually have done this. Maybe I'm not entirely sure if that first date is accurate because I think we saw him a little bit before that though too. So I'll double check on that part though. But it's several months out, and you can see that process right here. Let's see here. Undo is saying, do you agree that a bad gut leads to bad skin and acne? If you do, can you explain? It's not necessarily that it's like bad gut. I do think that certain things are inflammatory and they could cause more oil production. So something like dairy products, really easy, to really cut out of your diet. Processed food is another one that I would say that could really be a culprit for causing oil production as well. I don't really understand when people say like the gut health thing by itself, unless they're referring to that like you're damaging your microbial flora because you're doing antibiotics or you're doing other things like that. I think it's kind of overused the way people say it, but I do think that certain things can cause inflammation in that, and that actually could be a big problem for people because that inflammation actually ends up causing you to get oil, and then sometimes your scars could look a lot worse. So you can see one of the things that we did for this patient, we controlled his oil really, and you can see part of the reason why his scars look a lot better afterwards because his oil production got a lot better too. So that's something that I do a lot with whenever I do these treatments. I want to make sure that the oil gets better controlled too. So we could see that the diameter of the scar shrinks a bit with that. How to stop skin picking? So it's a lot of times due to anxiety. It's due to there's a lot. There's a lot of different factors. Anxiety. Also, sometimes people just feel like they don't have as much control over their skin. They feel like that's something that they potentially can, they're constantly stressed out about it, constantly thinking about it. And it does go sometimes hand in hand with body dysmorphia as well. So sometimes you can see that where body dysmorphic patients, the people that are very, very obsessed with it, worried about their body, they may feel like someone's constantly looking at it and they feel really stressed about it. A lot of times it's actually combined also with things along with loneliness also. So loneliness and in isolation and potentially like feeling like people are bullying. And so there's sometimes these external issues that are causing somebody to pick their skin and really become really obsessed with it. So sometimes if you could try to control those external factors, I mean, that's going to be helpful. But sometimes the fact that you have acne is part of the reason why you're lonely or the reason why you feel like you're being bullied. And that could be more of a challenge. So what I kind of want to say is that sometimes what you have to do is you have to sort of like just take a step back and realize that these things do get better. Well, it does. Like this is like a moment right now in time, and it's a small sliver, but in the long scheme of things, it's really difficult to kind of wrap your mind around it. But you have a long life ahead, and in your long life, this phase where it's really, really actually like inflamed, or if you feel like you have a lot of acne, it's not forever. And there's a lot of things that we could do to control it, a lot of things you could do just even at home to control it. And there's a lot more hope than you may expect actually to get it better. So I would just tell you that that's something that you should probably kind of think about though a little bit. There's really should be a campaign within this acne and the scar world of just, it gets better. This gets better. It's not like you're just like, you're destined now to just always have, terrible skin or feel terrible with your skin, about your skin. Lucky Singh is saying, hi, Dr. Qazi. I had a consult with you, a different name. I mentioned I don't use social media. I cannot afford the quote. Are there any discount sales options? You are incredible. My first and only choice. I appreciate you, Lucky Singh. We could, it's not that we do discounts and things like that, but there's things that we could do in terms of like breaking it up potentially. Sometimes it's more like volume replacement. It could involve things involving more with subcision, TCA cross. Those are going to be potentially be more affordable for you. Like you said, I don't know, you're using a different name on here, so I'm not sure who you were, but the truth is that we could probably try to break up some of these things. It's just that I give you the best possible treatment options, the best things that I could do to really get the best possible results. But maybe there's other things that we could split up from there. Lig is saying, I guess it's, I'm not even sure. IJ is saying, I cured acne with isotretinoin. I still pick my face. What are you picking? Are you picking your scars? Or are you picking some of the remaining bits of acne? What's happening with that? What was the treatment with this patient, please? So this is with TCA cross, this is with laser, this is with subcision, and then we also had done some filler. There still needs to be a little bit more volume replacement for this patient. I'm going to work on it. He was actually somebody I checked with the ultrasound the other day, and there were still some areas where it still looked like it was tethered, it was still stuck. So I'm going to actually end up breaking up some of that scar tissue still in the forehead. The forehead is an area that we don't want to use sharp tools. I only use blunt cannula, so sometimes there could be areas that's still pretty stuck there, even after I did subcision. So it may end up being that I have to do it a couple times for some patients, especially someone like this. This was more severe in the forehead area because of how much volume loss there is. He's, I think, just in his 20s, and when you have scarring on the forehead, or anyway, really just acne on the forehead, it's really easy to scar pretty quickly. And what ends up happening is that when you get a scar, it can really quickly get stuck, tethered, and sometimes it can really destroy the fat cells as well. So this fat itself gets scarred really quickly. So subcision works very, very well on the forehead. I don't believe in doing sharp tools there, though. I think it's really too risky. I'm a big believer, though, in doing forehead filler, though. So usually I would start with hyaluronic acid filler, but I'm a big believer in that. I think that if you could help start working on solving the actual volume loss for these kind of scars, you could really get a much better result, and that's part of why we got such a great result here. Tony Santana saying, hi, Tony, by the way. Hi, Dr. Qazi. I asked this yesterday, but I got off before I could hear your answer. But what's good for dark circles, eye bags, especially after Accutane? So what I was saying is that sometimes it's really just due to post-inflammatory hyperpigmentation, and because your Accutane made you a little bit more sun sensitive. And so we may want to do something that, first of all, is going to help lighten the area, where you could do like Eucerin's anti-pigment cream, like on the boning process of that. That could actually help with that. And then you also may use something like the Pico laser. But if it is true eye bags, I mean, I don't know if that's really going to be necessarily from Accutane per se, but really true eye bags where there's actually some fat that's herniating out there. It may need actually surgery, or you could do something where you do in the mid-cheek area, you support that area with something like Bellafill could work well because it doesn't draw in too much water. That could work really, really nicely over there. So I have to see really, is it true volume loss? Is it something that's just like fat herniation? What exactly is happening there? Shanta Desai saying, hi, Dr. Qazi. I had a glycolic acid burn about 5 months ago that results in a red pinkish PIE discoloration. Would a Derma V laser help with this? So usually my preference is to start clearing up some of the hyperpigmentation, the darker pigmentation first. I actually clear that up first, and then I'll start targeting actually the redness of it. So, and Dermovie could help with that redness. It's not going to help really with that darker pigmentation though. Danny Boring, good seeing you on. Danny, what is your opinion on med spas who say they can get rid of acne scars with microneedling? I tried and felt like it did nothing. It's just, it depends on what they're doing it for. If it's really mild type of scarring, like very, very mild, maybe that can improve it a bit. But it's definitely something that, I talk about all the time. I want people to be educated about that microneedling for the vast majority of scars is not going to help. It's not going to be really work enough. These kind of treatments just really are pretty ineffective. This patient, fortunately, he didn't end up going down that route. He saw my lives, saw my work, saw what I was doing, and he was suffering from acne scars for a while, and just basically knew that this is what the best possible plan would be. So he came over to me. So he did that without doing a whole bunch of other treatments. He's a patient who's East Asian, and if somebody had seen him and done just lasers on him, they would never have gotten these kind of results. Somebody saw him and tried to do microneedling, they would never have gotten these results. Vast majority of people try to do like subcision or volume replacement, and they still can't get that. So I'll show you this kind of patient over and over again. I think we have his video as well. It's really, really cool because you can see just like that process, the progress of him. He's a really nice gentleman, and he's got a lot more confidence for just day to day. You can just see it. What was the treatment with this patient? So this was with subcision. I did blunt cannula subcision. I did TCA cross. I did also hyaluronic acid filler as well. Austin RN is saying over here, Austin, I don't know if you're still on, but Austin is saying, hi there, I had RHA2 filler and still have a bump on the cheek. Would you be able to dissolve with ultrasound? I'd also like to get subcision and Bellafill. Would you be able to do this the same day? It's possible that we could do that all in the same day. The Bellafill is fine when you do it with hyaluronic acid, but we'll have to see exactly where it's at. We have to double check to see to make sure that it's appropriate. Otherwise, we may just want to space it out. Even though I know it sounds like you may be further away, and I'm sure you're a busy person. You're a nurse, but the best thing sometimes is to space it out. I'll take a look. I'll let you know if it's something that I could do that day or not. If I can, of course, I'll try to do it that way. What would you recommend for a chickenpox scar? So a lot of times you could just go undermine the skin a bit there with something like Bellafill, potentially that could help, and then laser to resurface the edges works very, very well. I've showed some patients with wide boxcar scars earlier. Last week too, I was showcasing that. Really, it's almost completely gone. And it's really about going underneath, breaking it up a bit there, placing something for some volume, and then resurfacing a bit. Sometimes we could use also a bit of TCA, and depending on the depth of the scar, depending on how thick it is, we may need to do an excision as well, or something like punch elevation. All options there. Thank you guys. And I don't know, Austin, are you still on right now? Did you hear what I said? Because I think you just repeated the question earlier. Thoughts on ProFractional for depressed acne scars? So it's good for, I've used it more like a blending approach. And in fact, I did it for this patient also, where I essentially did CO2 laser for some parts of the scar, and then I used the ProFractional erbium laser so that everything's evened out. I do it for that. I'm not like a huge fan of doing it really for just like atrophic scars though by themselves. I think you have to do other treatments, potentially like TCA cross or volume. Good seeing you on too, Mrs. Jones. Thank you so much for always for your support. Appreciate you. Shamens is saying, thoughts on thulium laser for Asian skin. For pigmentation, it's okay. It's overheating the skin though. I don't really think that that's the best option for the vast majority of patients though, to be honest with you. Ganesh is saying, doctor, for that type of ice pick scars, will filler give results like that because I have exactly the same scars on my temple area? Yes, this was also with filler as well. So yes, this would do that. You can see the part of this is actually also that volume was really depressed because of the scarring. So I did some filler there. I also am working on doing temples with Bellafill for this patient. And so you'll see over time it's going to get better and better for this patient. How is this fixed? This was with subcision. This was with TCA cross. This was with where I went under the scar tissue, I broke it up, and also placed a little bit of hyaluronic acid filler there. Ganesh, I answered your question actually. You may have missed it there, but I was saying that this was also with filler as well. And vast majority of patients, especially on the forehead and certain parts of the face, they really do have more fat loss, more volume loss than you may expect. I know people just, I hear all the time, I don't want to do filler, I don't want to do filler. And the thing is that filler or something, I mean, it doesn't have to be filler, just do something for volume replacement. If you want to do fat, that's totally fine. But this patient, he's I think 6'4", something 6'3", and he's almost got like no body fat whatsoever. He just we can't get fat. So how are we going to do that? So we have to do things for volume replacement. And we've been working also now on getting it so that we can relax his muscles over there. One of the big things for the forehead area, also the crow's feet area, you want to knock it out with Botox or Dysport. You want to prevent movement. You want to prevent contraction. And that's what we've been working on too with this patient. So that's helping as well for him. So it's going to actually help that the scar to continue to remodel, to continue to improve over time. Let's see, Austin saying, thank you for the answer. Yes, I'm out of the area in SF. How long for the recovery for subcision with Bellafill? That's really not going to be too bad. If it's more of the subcision part, that could take about 4 days though. The subcision could potentially take that long to recover depending on how thick those scars are. Do you treat melasma? Yeah, I do it all the time. I showcase a lot of results actually for melasma. You could take a look at our page. We have a lot of melasma results actually. It's something actually I started doing when I was jumping into my practice really more with hyperpigmentation because I knew I was treating darker skin types. I needed to make sure I could clear up darker pigmentation. And everybody at the time, everybody was saying that melasma is just impossible to manage, impossible. Don't use lasers, don't do that. And it was just like, they were doing a lot of things. So I saw what they were doing in Korea. I saw what some people were doing, in Australia, Dr. Davin Lim. And I was like, looking at this, that there's clearly a component here where pico lasers, for example, other modalities could potentially help out. And certainly in Korea, they really were advancing a lot of things for melasma because it was very, very difficult to treat Asian skin types with the hyperpigmentation. And I knew, being in Orange County, I have a huge Asian population over here, and I needed to make sure that we could do this very, very safely and clear up that pigmentation. And we do it all the time. We were able to do that. Are rolling scars caused by a cluster of acne next to each other? Partially, yeah. I mean, that's part of the big reason why. And sometimes it's more like a couple boxcar scars, but sometimes it could just be injury over and over again with some sort of cystic lesion that ends up just basically just pulling down the skin there. And you got these fibrotic bands that way. And so that's, partially what you end up seeing. Not all rolling scars require subcision. Sometimes it's just relatively superficial. In fact, one of my patients today, she had rolling scars, really superficial, just going to do some Bellafill for that. It's going to solve it. I don't have to do subcision. The boxcar scars also can be tethered. Ice pick scars can be tethered. In fact, they all are tethered. It's just how thick the tethering is. And if there's just a bunch of them together in one area, then you likely do need to do something like subcision over there. It's not going to be enough just to do like a laser, not going to be enough just to do some Bellafill or something like that. How do I prevent hyperpigmentation? I treat mostly Fitzpatrick 4 and above patients. Most of my patients are really Fitzpatrick 4 and above. And what I do is I pre-treat the skin, and then I make sure that my laser settings are very, very precise. So I'm just doing in certain areas where I use that kind of heat and energy. It's a lot lighter blend elsewhere. And then afterwards, just follow my protocol. Just really follow the protocol. It's super important. I mean, it's just like, I can't emphasize it enough that we really can avoid problems. If you avoid sun exposure, just follow what I do. We could do this really safely over and over again. And that's going to be awesome. Is rosacea caused by gut health? So again, the gut health question, I was not sure about what that was referring to with gut health. I do think rosacea could be, of course, certain inflammation. There's some things that like spicy food potentially could do it, alcohol. And by the way, alcohol, really, I tell everybody, really, when we're talking about for scars, really, you should really quit alcohol. It's really going to be the thing that's you're going to see, it's going to help really with your collagen production. You're going to see a better, you're going to see you're going to look a lot better. Really, people should just quit alcohol, really. I mean, if you're not going to do it for like your body, just look at it for your skin, and you'll see that like, I'm not like against you if you just want to do it for like once or twice, like, here and there, but like really, like it's not helpful for you, it's not. And it's what ends up happening sometimes is that it's going to delay your collagen response. So people that end up getting like the best possible results are the ones that actually have a cleaner diet. They've really cut back a lot of those things, and they made that decision to do that. Shaman's is saying, do you use Botox on some scars? There's a way that sometimes people do that actually where you could get a little bit of contraction with it, but it's a temporary effect, not something that's really, really helpful, really. It's really not. It's just too temporary, really, to affect it. I do Botox all along over here, for example, in the forehead area for this patient. I did it for this patient in order to relax the movement, so he's not raising his eyebrows as much anymore. So that way, there's not much scar contraction. I did it for that purpose, but I'm not doing it actually for for the scars themselves. Sometimes people say that you could get a little scar contraction that way, but it's just too temporary. I don't really, I don't do it that way. I like things that really are just more about just like long lasting. I want things that are just going to last a long, long time. And, Botox, things like that. Sure, you could get a quick result to look nice, but it's like, I want this to be like yours. This, you get to keep it. It's really cool when you get to keep it. It's really cool. Let's see, I missed a few things here. Punch excision or TCA subcision for deep ice pick chickenpox scars on forehead. For punch excision on the forehead, you can do it for deep ones. In fact, I was debating for this patient if I should do it or not, but I knew that really there's a lot of contraction. There was still a lot of movement in that particular area. So I opted not to do it. It ended up being just totally fine without it, just doing subcision, doing TCA cross. There's a little bit more risk involved with excisions in general. So instead, I did TCA cross, I did subcision, I did a little bit of filler for this patient and some laser. That worked out really well for him. So, I think that's a great game plan for a lot of patients. You don't have to do excisions if it's, especially an ice pick scar. Just doing TCA cross constantly is really, really helpful. But wide boxcar scars, deep wide boxcar scars, sometimes that's the best option. Sometimes you have to make it into a small narrow scar, something called an elliptical excision. How long does Sculptra last? Sculptra lasts for 2 years. So Shaman's, just to clarify for the Botox, I didn't do it in the scars directly. I did it just as a regular for the movement. So basically just the way people would normally do, just to help with movement. But there's a technique that what you're referring to is that some people do directly in the scar. I don't actually prefer it that way. There's a way to do it. You can do micro Botox in there. It's just a temporary effect. It's not going to help enough really for most people though. What was there? Hey, Miriam, how's it going? This was with TCA cross. This was with subcision and filler. And this is with laser. And then we did do a couple more rounds of TCA cross for this patient. And at some point, we're going to do a little bit more volume. I'm going to actually, if we could freeze his face, probably do a little bit more also in the temple area, some Bellafill as well. Let's see here. Stephanie's saying, when I finish school and I have money, I'm going to you. I have a dilated pore on my face. I'll be happy to help you. I'll be happy to help you with that. Do you recommend fractional CO2 if one can't afford ablative CO2 for lasers? I'm not sure. Oh, sorry, for scars. I'm not sure what your concern is, though. It depends. Maybe you don't need a laser. I don't know. Best dermatologist in Asia. I can't say I know anybody in Asia that does scars. If you're referring to just like broad for dermatologists, I don't really know anybody in that area. But I'm sure there's somebody out there. There's somebody that reached out to me that in the Philippines. I'm not sure if that's where you're at. Here and there, I see their work and it looks very good. I can't remember the name offhand though, to be honest with you. But I saw someone in the Philippines if that's what you're asking. I'm not sure if that's the location that you're in. And Dr. Dunraj is in India. That's correct. Yeah, Dr. Dunraj is over in India as well. And I got to remember who it was in the Philippines who I saw looked like they had good study work as well. Melly Elephant is saying, I plan to take my son after he finishes Accutane on a high dose. Should I wait 6 months or a year? I'll be happy to see you sooner. Sooner. It just depends. Maybe we don't have to necessarily do like a lot of energy. We don't have to do like a lot of the heat, those type of base things. But you actually could do a lot of these treatments while on Accutane itself. It's not that you have to, avoid all that. How to get rid of milia. So the way to get rid of milia, sometimes you could just actually burn it off occasionally if it's stuck there. Otherwise, you could do like a low dose of retinoids or retinol, I should say. Low dose retinol, especially if it's around the eye area there. So which area are you talking about for Asia, though? I could kind of think about it then a little bit more. I'm not entirely sure. And to be honest with you, I don't know too much, like, because I don't interact. Sometimes I see some of their cases. I do see some of their cases for people that they come over from Asia. I have patients from Asia. I have a lot of patients from Korea, actually. I have a lot of patients from China, like mainland China. I'm kind of familiar with like the stuff that they're out there, but I can't say that, there's anybody that I've heard that's like been amazing, that they felt that they were really happy with. It's also possible I just haven't interacted with those same patients that have done everything. Would you recommend baby Botox for a frown line only in the right side? Yeah, absolutely, do that. Fusurious is saying, hello, what are your credentials? Are you board certified in the US? Yeah, I'm a board certified internal medicine doctor. Let's see here. Where was I at here? How much for recovery if patient gets TCA, subcision, and laser? So that's going to be about 4 to 7 days. 4 to 7 days of recovery for that. That's typically the amount of time for vast majority of patients. Austin is saying, just wanted to add what you mentioned earlier. I'm not the biggest fan of filler either, so I was curious if subcision and fat transfer is an option for significant volume loss due to cystic acne. It absolutely could be. It depends on where it's at. It absolutely could be that case. That it could be that we may have to do fat transfer, especially if you don't want to do filler. But there's ways of doing filler. I mean, you had a bad experience with RHA, and honestly, a lot of people have had bad experiences with that. Sorry to say, but like it's a product that just draws in too much water. It just keeps on drawing in, and like you think that you put a little bit in there and it just keeps on drawing it in, and so it's possible that just the product that was used was just not the best product for you. There's maybe better options there, to be honest with you. Where are we located? Are you ever going to New York City? No, I actually have patients from New York City, a couple of people that I've worked on just this week, actually. And I just have everything in my practice over here. So I just want to have it so that everything's really streamlined for us and it's really safe. And my team and everybody is just like, it's helpful just to make sure that everything's done properly for us. Velvet is saying, Fraxel to remove broken capillaries on my face. They went too deep, burned, and scarred me. Advice for scars. I'm sorry to hear that happened for you. That was odd that they did it for broken capillaries on the face. I'm sorry that they did that, actually. That may have been way too aggressive. I have dealt with lasers, scars from lasers before in the past. Actually, basically what I sort of did for this patient as well. Basically, low energy lasers, things like erbium lasers, do that. It actually helps a lot. Lino's saying, is there a way to get rid of white patches on darker skin that were created after a fall? That's really difficult. It's tough to say if it really necessarily is going to get back completely. You may try to do a little bit of a laser, like a CO2 laser, see if that'll actually wake up some of that pigmentation. But it's possible because scars sometimes, especially like traumatic scars, can go so deep that it may have actually destroyed it there. Is it okay to continue using tretinoin 0.025 even though it's very, very drying? You could just mix it with a moisturizer, kind of reset yourself a bit, do it for that for a couple weeks, and then slowly just start going back to doing just a little bit low dose of tretinoin there. So that's typically what I would recommend there. You are on the right dose, 0.025, just maybe you just mix it with a more moisturizer. Does pico laser help with stretch marks as well? Usually stretch marks are, it depends on what color they are, but usually there's some texture. So what I like to do is actually use an erbium laser, lighter settings, use your erbium laser, resurface a bit there, and then we can see what color it is. I'm not sure if it's darker, then sure, pico laser could work well. If it's lighter, then something like XLV. So I'm not sure what color it is for you. How do you feel about Moxie laser for melasma and acne scars? I think it's a pretty poor choice for both, to be honest with you. There's way too much heat for melasma. I know that they try to say that it's like, the best for, it's like the gold standard. I don't know where they got that idea from. Like people say, oh, it's the gold standard for melasma. That's what people are saying to me. I'm not sure where they came up with this gold standard for melasma is, but it's not the gold standard. It's way too much heat. And the other thing is that for scars, it's really mild. So I'm not sure what they're referring to when they refer to as gold standard for melasma. That's unfortunate that they're using that term because there's certain things, like you could say, for example, that like certain cholesterol medications are or putting someone on cholesterol medication, that's the gold standard for high lipids. But like I don't know what they're referring to when it comes to this melasma and using something like the Moxie laser. Austin is saying, I'd like to set a consultation. Do you set appointments on weekends? I hardly ever do any weekends anymore. This year, I almost have none. I just want to just relax a lot more for the weekends now. So just recover, I just enjoy my time off. And just catch up on some other stuff there. So I doubt that I'll be doing much with the weekends, but you could always make a request to our staff. There's a way that they could see that there's like one or two that potentially that they may still be available. But otherwise, yes, during the day. And you're said you're in San Francisco area. A lot of our patients are from the Bay Area. They just fly in and fly out the same day. You could literally do it that way. I would just recommend doing that and just schedule a virtual consultation. We could take a look and see. So I'm not saying it's impossible to get a forehead. I was looking at forehead, someone forehead question there. I'm saying it's not impossible to get the weekend thing, but it's pretty close at this year because it's like just my schedule just doesn't allow it there really. Let's see here. Period is saying, I have hypopigmentation, flat scars, and a one deep scar on my forehead. What would be my best option? I'm not sure where the hypopigmentation is though, but sometimes laser to resurface those hypopigmented areas actually can improve it. Flat scar, one deep scar, all that, it's tough to say. Flat scar is easy with a lot of times with laser. One deep scar on the forehead, probably a little bit of volume there. So probably what I would do. Priyanka, that's a long talk. Priyanka wants to know how I went from IM to skin restoration. That's a long thing. I've talked about it a few times on here, but I'll just say briefly that it was a lot of different things. I suffer from acne, I suffer from scars, but when I was in med school, I also just wanted to work on just like seeing everything. I love doing everything. So I did like trauma surgery, I did burns, and I was thinking maybe I should get involved in that. I did a whole bunch actually over in Thailand for trauma as well. So I was like really interested in the trauma world. And then I came over here a lot more with like a Cook County Hospital, and it was supposed to be like one of the better programs for trauma surgery. And I was looking at it like, man, this is just like, it really wasn't like, very, to my mind, I didn't like the aesthetic afterwards a lot of times. I just found that it just wasn't the best. So then I was circling back to see what other things I would really like and enjoy. And when I was in these like burn units and things like that, there was a lot of different medical issues that these patients were on. They had so many different medications that they were on, and we were like saving their life constantly. They were very, very sick patients. The burn ICU was very, very sick. And so I saw that really medicine was actually pretty cool because I could literally save patients' lives like acutely and still kind of think cerebrally, which I like to do. Like just really, really think through things a lot. And so then I went down that route, and then I was going in the hospital world, and I realized that the hospital system is just terrible. It's just like designed really to really just have like this business really where patients' health is like secondary. What they really cared about was really just discharging patients at a certain point in time. They wanted somebody, the good doctors were people who discharged before 9 o'clock or 10 o'clock. And it didn't matter what antibiotics people were on, didn't matter really what like their medications or anything like that. And I saw it was just a really terrible system. It really, really was. And it was like just I realized also that it was impossible to be like independent of that system. You just can't. You just can't actually like do medicine the way you actually want to, at least the way I saw it there. You can't be successful and do it that way because the hospital systems all had the insurance. They were able to dole out really the money for everybody, and you couldn't really just be an independent practitioner there. And it was like terrible. I just saw that like, one time I had, it was like a wild situation when you actually look at it. I think one of the moments I should say that I was really that I need to get out of this. We had so many patients all the time, and they assigned me to somebody who was relatively like a celebrity. His dad was a patient at the hospital, and they wanted me to take care of it because they thought that, okay, I could be efficient with it. I'll be able to explain things to the family, all these things. And it was fine. I was going to do it anyways. But the way that there was so much like movement now to move everything, like all the doors were just open for this guy and his dad. And it was like this tier system that was wild to me that like, all this time telling me, oh, we can't do this, we can't do that. Oh, radiology can't do it that time. They can't do this. Suddenly now this celebrity was here and everything was open. Like they were just like, for his dad, like suddenly now they're just like running around. The CEO is calling me multiple times. The CMO, the chief medical officer is calling me. They're telling me that this. And it was like everything, like just like, wow, like, this is just ridiculous that there's like this tiered system in this medical system, and which we were aware of, we know about, but like it was really unfortunate. And you see that stuff over and over and over again. And you see like how they treat, like really how they treat people who have really African patients who have, sickle cell disease. You start seeing that like, my colleagues are just like not managing their pain control. They're saying that everybody's a drug seeker or something like that. And they're like, you're looking at this, like, this is absolutely like craziness that they're considered actually good physicians because they're not giving the appropriate medications to people, and they're just labeling somebody as a pain seeker. And like, I mean, just imagine, sickle cell is like just like one of the most painful and excruciating diseases you could possibly have. It's literally going like all your body, and it's inflamed. And it's like, just imagine this now. And these honestly, they're terrible. They're terrible people because they're literally denying them pain medication and narcotics. And I used to, in residency, even like my residents were really great, really good people. But sometimes some other people would sometimes be putting people on inappropriate pain medications. They'll just stop narcotics on people that needed it. They would stop it for like sickle cell patients. And it's just, it gets to you. Like, you look at this and like, man, you have no agency in this thing. I can't manage this. So I was like, I need to do something that I can control from start to finish. Like, everything I do from scars, I control from start to finish. This is on me. Like, it's my hands, it's my work. I could do this. And like, I was looking at this, like, I could do that. Like, just, I'm going to do this. So I could actually sit back like every night and just look at this and take a look at this and talk about this, because it's like, I did it, it's like, I can't like say that, somebody was like over my head telling me to go discharge somebody in front of, like, that's just ridiculous. It's terrible medicine. And then it's like, you try to save someone's life in the medical system, you work on it for a week, and then you give a recommendation, you hand it off to another doctor, and the doctor just does garbage, and the patient dies. And it's like, man, that stinks. You just kept a patient alive for a week. And then because there's a garbage doctor now that's like one of your colleagues over in the hospital or so, and they were just lazy or didn't know how to manage something, and now the person died. It's like, it gets to people. I don't think anybody in that thing gets like really. And instead of me, I was like, you know what? The thing with me is I don't want to get jaded. I never want to get jaded. I told you before, I'm not the kind of person who's going to bend the knee. I'm not going to like, kiss boots. And so for me, I was like, you know what? I'm just going to do my own thing. I'm going to work. I'm just doing things at a really high level myself, and just do it with my own hands and build things myself. And I did it. And so it's like, I do it over and over and over again. It's like a lot of stuff actually just needed to be changed within this role too. I was looking at, because they're messing my face up too. And, it was like over and over, it was like nothing was working. And it's like, man, they don't know how to do these patients of darker skin types. So I realized that, like, I love medicine. Actually, I love it. I saved so many lives. It was very, very rewarding. Talked to so many patients. To this day, you'll see sometimes nurses, things like that'll come on that will say that, like, they work with me or so in these hospital settings. And like, I'm very happy that I did all those things. And I think a lot of the team was really, really great. All the people that were, trying really hard, but it can really quickly get people down. You could really start getting very jaded very, very quickly. And it's like, I just never wanted that. I never wanted to feel like something was just defeating, that there's some other system that was defeating me. One of my big things, one of my big goals in life is just to be completely free to be able to do the things that I do and work the way I want to do and tell people exactly what I want to say, and like just explain it to help people. I really want to do that way. And that's like, I just don't want anything over me to prevent me from doing that. That's why I've always managed to make sure that I was independent in this thing and unsponsored, just on purpose that way. So I just could stay in my zone and just like work on like helping out people. And it's just like, I don't need like it's actually really funny. I deal with people so many times, and sometimes they're just like blatantly like racist sometimes. And I'm looking at it like, they just haven't really encountered something like that, where it's like, I really just want to, like, it doesn't matter to me about the money portion of things like that. I really just want to just like do my work and like just like get things better. And it's like really cool to see that process for me. Like, I enjoy that. It's exciting to me to see people succeed. It's exciting for me to see that whole process. Actually, it's really cool to me. And like, I like it. And I think there's a lot of people that think that way. I think that it's just, medicine, sometimes the way the system is, it's actually just destroying people's love for that. It's destroying people so that they don't actually feel like they're making a difference, and they just keep on going around the same pathway over and over again. And they end up just not improving, people's lives, because it just, I feel like, I'll just go to throw some random antibiotics, throw some random lab work, and all this other stuff without actually critically thinking about stuff. And end up really just with a terrible healthcare system. And that's where we're at today. You know, that's exactly why you guys should blame like, capitalism. You should blame modern medicine the way it is. You should blame really all of that. You really should. You should really look at it. It really should just like look at things and think, if you ever had like a health condition, any problem with that, it really should be like an eye-opening experience when you navigate our healthcare system. It really should. You should really look at it and realize that this is just like wrong. And it doesn't matter if like, oh, someone will say, well, other systems, as soon as you say, it's like, well, Canada system, they have a long wait time. It's like, I'm not saying to go do Canada system. I'm not saying we're Canada or anything like that. It's just like, this is clearly not the way to do it. And it's like, not my job for me to figure out like how to do it, although I have ideas, but like, somebody should do their job. I do my job really well, and those people need to do a better job. You know, they need to do a better job at like fixing this system, but they don't have any incentive to. They have zero incentive, zero. They have negative incentive. Actually, they will lose money. All these health insurance companies, they'll lose money if they do that. So they have zero incentive. So it's like, who's going to get them to do that? I don't know. Maybe people know. Thank you. Appreciate everybody today. I can't specifically recommend somebody, like I don't know per se, someone who's asking for a dermatologist, that if I could recommend them. Sometimes I see people's work and I can't necessarily say that for sure if I could recommend them. So you could take that for what that is. Priyanka saying, wow, thank you for sharing. Was just interested to know as a med student, that makes sense for sure. Yeah, just keep doing a lot of rotations and don't get jaded really. If you're a med student, just keep doing that. Honestly, there's a lot of stuff that you could do, a lot of different pathways you could take. Really, there are. But the system itself really is very, very limiting. And so try to see like how to make sure that you could always be independent. And I always tell people just like, just never try to like, just compromise on these things. You know, there's certain things that like should just be a line, and you have to just keep that line. And like, just that way, like, you just know that like, okay, what you're doing is like, it's clean. And it's like, it feels good. It's like, you have like this clean thing that's just like, that's your life. Thank you guys so much. I'll see you again on Monday. I know I missed a bunch of questions, but I went over my time today, and I have a lot of cool cases. Tomorrow is actually Microlipo day. I'm going to be doing Microlipo and face tight tomorrow, so I'll do that tomorrow. I'm not sure if she lets us share. I'll see if she does let me share, but